Dentists and dental care professionals have Reddit. What oral hygiene products out there are gimmicks? And what are some underrated products that people should use more often? Dentist here. Another thing nobody has mentioned. If you ever puke, don't brush right afterwards, since the pH of your stomach acid can temporarily soften your teeth, and you can then damage your teeth when you brush. Instead, you should rinse with a baking soda solution to neutralize the acid, and then you can brush your teeth maybe 30 to 60 minutes later. Also, I agree. Use electric toothbrush. Brand doesn't matter, as long as it is a real one that doesn't use a AA battery. Also use real string floss every day. Cavities come from frequency of sugar exposure, not amount of sugar exposure, so sipping a soda/juice/Gatorade/Red Bull for hours is much worse than drinking it in 5 minutes. Dental nurse here. Anything activated charcoal is nonsense. Black toothpaste is no more beneficial than normal toothpaste. As long as your toothpaste has fluoride, it's doing its job. Floss alternatives are gimmicks. Most are intended to be used in conjunction with floss, not instead of. Just floss. It's the most effective. Electric toothbrushes are your friend, but regardless of electric/manual, make sure it's soft bristled. Edit. By floss alternatives, I mean any product designed to replace flossing altogether, such as picks for interdental brushes, flossets/floss picks, water picks, air flossers, etc. Get an electric toothbrush. Seriously, a good electric toothbrush is an excellent tool for dental hygiene. Don't get a water pick, floss pick, or any other replacement for floss. Just use floss. It's super cheap, and if you haven't been flossing it will be sensitive for the first couple of weeks. Just keep with it, it will get better. Whitening strips work, but you can risk bleach burn if the strips overlap your gums. Same with power whitening. You will likely be sensitive as hell after power whitening. The best thing you can do for whitening is get professionally made trays and use them as directed. Bleach burns suck, and they can happen if you aren't careful. Aside from that, keep up with your cleanings. There will be things that you miss when brushing and flossing, and the point of cleanings is to catch what you can't reach, and to examine for caries while they are, hopefully, small. Edit. Got a lot of responses on this one. I want to take the time to clarify a few things. I'm a dental assistant. I have experience and have been around the dental field for most of my life, but am in no way a dentist. As such, I can only give general advice that I would give most patients. After reading a few responses regarding water flossers and floss picks, I should clarify. You should do what is best for your situation. Something you technically shouldn't do, but will, is better than something you technically should do but won't. That being said, floss picks and water flossers get the job done, but aren't ideal. Effectively, they do not have the level of manual manipulation that floss has. Aside from that, floss picks are only one small length of floss that you are using for your entire mouth. It is similar to reusing a washcloth. You could be reintroducing bacteria and food particles that you would not with a longer length of floss. Most importantly, listen to your dental provider. They will be able to give the best advice for your situation, as they can see inside your mouth and see yours rays. Electric toothbrush changed my life. I had a dentist recommend it because he said I was using too much pressure. For the record, did use the basic Oral-B for a long time before switching to the Sonica. I then proceeded not to go to the dentist for at least 4 years, and when I finally got off my ass for an exam I had 0 cavities, and previously I had cavities pretty much every visit. On one visit I actually had 5, although like 3 of them were on my molars, and dentist said it was probably the result of not having sealant applied on my teeth as a kid. Anyway, I really recommend an electric brush, especially if you struggle with cavities. I've heard people say they don't trust electric toothbrushes and figure they do a better job manually, and just, no, you probably don't. My new dentist office didn't even bother with fluoride treatment cause they figured I wasn't actually cavity prone. Go figure. Dental student here. Get an electric toothbrush, Oral-B or Sonica. Don't buy charcoal toothpaste, it will destroy enamel. Choose little gum like icebreakers, Mentos, IEPA. All toothpaste is basically the same, just make sure it has fluoride. Don't rinse with water after you brush. Just spit as much toothpaste out as you can and leave the rest. Listerine first before brushing. Use Act Restoring mouthwash as a fluoride boost during the middle of the day. Brushing at night is the most important time. Your teeth have time to repair themselves. After eating anything acidic or sugary, rinse with water. Not a dental student or dentist, but I know a thing or two about biology. Don't use mouthwashes with high % alcohol. It increases your risk of mouth cancer. So does liquor consumption. By the way, use a mouthwash with fluoride before bed, and don't rinse with water afterwards. Do use mouthwash with fluoride. Not all toothpaste is the same. A shocking number of organic and fancy toothpaste doesn't have fluoride. Not charcoal. Fluoride. I know you said this, but my boyfriend was using some fancy toothpaste that didn't have fluoride, and I nearly ripped him a new one. Personally, I like Crest Pro Health Luxe toothpaste. It has whitening ingredients and a nice flavor. I use it twice daily and get compliments on my white teeth fairly often. This is remarkable, as the toothpaste is my only whitening routine and I'm constantly and daily drinking black coffee and frequently drink red wine. I'm not good at brushing my teeth for long-term consequences like cavities, but I sure hate when my teeth are stained. TL. Doctor, fluoride. 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 It literally chemically rebuilds and strengthens your enamel. Fluoride. If you aren't already tongue scraping, you should be. Absolutely most underrated oral hygiene product that most people don't even know about. You will never have bad breath again because you scrape that nasty ass white coat your tongue keeps dressing up and right off. And even if you aren't a smoker, you will cough up so much shit right after because that nice little phlegm blanket you just spat out was holding back its buddies in your throat, who are now free. Seriously, you will never be able to go back. Go try scraping your tongue with a spoon right now, which isn't as effective, but will convince you to drive to the store right this goddamn second to get yourself the real deal and see how good a clean mouth finally feels. Not the professionals in question. When I had my wisdom teeth surgically removed, the guy gave me 2 pills and told me they won't put you to sleep, but they'll numb the pain and make you calm enough to forget the whole thing. He gave me 2 more to take at home and asked me to wait in the lobby for an hour. Surgery went okay, but I was fully alert and aware, yet very calm. They wrenched my head around a bunch and drilled and poked and pulled things. Screwdrivers were used as chisels. Blood was suctioned. Still calm. At home, I actually looked at the bottle. Those 4 pills had just been plain Atazil. Not even the fucking codeine kind. He tricked me. Many years later, I happily recommend trickery. Not a pro, but had been having bleeding while brushing issues for a while. Dentist just said make sure to brush and floss, but I was doing that already. Read up on it, and found out that the oral microbiome is a thing. Ditched my detergent/foaming agent filled toothpaste for Zendium, European brand, and Carefree, American brand but formulated to keep pH in the mouth where it should be, and uses the ingredient, hydroxyapatite, that most of Japan uses instead of fluoride. Note that both do have fluoride. I just wanted to try the hydroxyapatite as an experiment. Also switched to an Exper once a week high fluoride, alcohol free, pH balancing mouthwash. Took about a week and I haven't had bleeding gums since. Started new regimen about 6 months ago. Dentist was all blown away at my last checkup and asked what I was doing. OFC, I use 3 new products, so I can't be sure if it's one of them alone or some combo of the 3 or just the absence of the harsher ingredients. But it's working very well. This is the first time I've had no bleeding issues since I was about 15. Edit. I forgot to add that I also no longer rinse my mouth with water after brushing. Just spit and go about my day. That's apparently becoming a thing. My dentist says it means the fluoride doesn't just immediately get washed away and can hang out in your mouth for a while to do good stuff to your teethers. Not a pro, but had been having bleeding while brushing issues for a while. Dentist just said make sure to brush and floss, but I was doing that already. Read up on it and found out that the oral microbiome is a thing. Ditched my detergent/foaming agent filled toothpaste for Zendium, European brand, and Carefree, American brand but formulated to keep pH in the mouth where it should be, and uses the ingredient, hydroxyapatite, that most of Japan uses instead of fluoride. Note that both do have fluoride. I just wanted to try the hydroxyapatite as an experiment. Also switched to an Exper once a week high fluoride, alcohol free, pH balancing mouthwash. Took about a week and I haven't had bleeding gums since. Started new regimen about 6 months ago. Dentist was all blown away at my last checkup and asked what I was doing. OFC I use 3 new products, so I can't be sure if it's one of them alone or some combo of the 3 or just the absence of the harsher ingredients. But it's working very well. This is the first time I've had no bleeding issues since I was about 15. Edit. I forgot to add that I also no longer rinse my mouth with water after brushing. Just spit and go about my day. That's apparently becoming a thing. My dentist says it means the fluoride doesn't just immediately get washed away and can hang out in your mouth for a while to do good stuff to your teethers.